I'm Cream. I'm going to give my regular introduction that I do on all my videos. I'm Cream, a.k.a. Miss Cream of the Crop, and you guys are joining me for Conversations with Cream, and I'm really excited because this conversation is all about beating the coronavirus in our community. So I'm really happy and excited to have all of you guys on the line with me. Every one of you guys means something special to me, and I value your thoughts and opinions. So I'm glad you guys were able to join me today in discussing the coronavirus in our community. And I just want to take a little bit of time to have each one of you introduce yourselves. So I guess we'll do it like we do in school and go in alphabetical order. So you guys should know who's going to go first. AV, if you want to go ahead and introduce yourself to everyone and tell them what you do and who you are. So go ahead and start.
Hi, I'm Alberta. I'm a registered nurse here in Cleveland, Ohio. I work for the Louis Stokes VA Medical Center. And this is a very trying time for all of us right now.
Yeah. So thank you for taking time on one of your days off to have this discussion with us. So thank you so much for that, AV. And we're going to move over to Garb. You want to go by Garb? You want to go by which? It depends on which name you're going by. That depends on which time you go. Are you going by Mike or Garb?
Right, we go by Garbs. Everybody knows me by Garbs. It all really depends on whatever I'm doing. You know what I mean? So,
okay. Well, you're next.
All right, sounds good. Sounds good. Well, I appreciate you having me. I'm Garbs Infinite. I'm involved with experiential event marketing and promotions. Co-founder of the Ohio Hip Hop Awards. Of course, that doesn't exist right now at the present time anymore. But I've done a lot in the community, in the hip hop community, radio events, all types of stuff.
Yes, yes. All right, so then we're going to move over to Kayla. You want to go ahead and introduce yourself to everybody?
Hello, I'm Kay Palmentera, and most of you guys know me as a photographer. I do photography, and I'm also getting into youth guidance as well. So that's me.
Yes, yes. And then last but certainly not least, we have Christy on the line. So please go ahead and introduce yourself to everyone, Christy.
How's it going? I'm Christy Steele. Started off in the music industry. One of the first people who really looked out for me was actually you and Garbs. So thank you to both of y'all. Now I've moved on. I am closed Hip Hop Digital, and I have launched Save Our Families, working on putting some programs together. That's why I thought it would be important for me to, come and speak on what's going on.
Yes, yes. Thank you so much. Like I said, everyone on here means something special to me individually, and I have a relationship with all of you guys in my own separate way. So your opinions and your thoughts are really, really important to me. So I just really wanted to, this is our conversation with Cream, and we're talking about beating the coronavirus in our community. And I was talking to AV a little bit earlier, and I was explaining to her why I really wanted to do this. And it was mainly because the media has been putting out conflicting information. Our president has been putting out, information that conflicts with what the media has been putting out. And then you have a lot of people in our own communities that have been putting out conspiracy theories and their own thoughts and ideas of where they think the coronavirus originated from and why everyone's getting sick, amongst the 5G. And just there's so many things out there that I feel has been confusing people, scaring people, or making people just not care altogether. So right. I wanted to talk about a few ways that we can encourage our community to be more proactive when it comes to things that happen like this, and instead of reactive, like what can we do to prepare ourselves for something that might happen like this in the future. The numbers in our community seems to be higher than other communities, and a lot of the reports are saying it's all because of how we eat, our lack of access to healthcare and information. So I just wanted to get more information out there to our communities and what we can do to make things better. So we're going to start with Avi. She's our healthcare professional, and I really want her to talk to us about what's really going on because she works in the hospitals, and there are a lot of messages going out there telling people that the hospitals aren't that crowded, the nurses aren't that busy, there aren't that many cases, it's just a scare tactic. So I really want Avi to talk about what she's seeing, what's going on in the hospitals, and how we as a community can be more proactive when it comes to healthcare, and why healthcare isn't as accessible, and why healthy foods aren't as accessible in our communities. So, Avi, you have the floor.
So, just speaking in general, if you were to go to Cleveland Clinic on any given day, you'll see there's plenty of cars in the valet turnaround. There's hardly any parking or anything of that nature because Cleveland Clinic has a lot of outpatient clinics as well as inpatient. What has been happening in the hospitals is they are canceling all of the non-essential appointments. So if you need to see a primary physician about a cough, they'll probably see you. But if you're going in just because you need your blood pressure checked, they'll write you a prescription for a blood pressure cuff, have you take your own blood pressure and document it, and then they'll communicate that via a televisit. Elective surgery, if it's not to save your life, those are being canceled. So they have emptied out hospitals. I know at the VA hospital, so we serve a particular population of veterans, but we have open beds. A lot of our units are empty because they're what they're called offload into different areas where they can designate a unit or two for COVID patients if it comes to that point. UH has plenty of units that are like that. I have a lot of friends that are nurses over at UH, and they've closed down certain areas of the Lakeside Hospital for COVID patients. But none of those units have been full. This morning, I looked up our most recent statistics, and in Cleveland, so far as of this morning, we've only had 12 deaths in Cleveland related to the coronavirus. They had 2, so up until last night, it was just 10. Looking at cases, there's only been 396 confirmed cases in Cleveland, Ohio. And I'm not only to minimize it, but we have to look at what's going on. In Cuyahoga County, there's been a total of almost 1,400 cases, but only 48 deaths in Cuyahoga County. Cuyahoga County is a lot. If we have 12 of those deaths, you know, that just says a lot that there isn't that many cases. Could it be that people aren't being tested the way they should? Possible. But a lot of these cases, just this week, I've had 5 rule-out patients where they are on the floor, either a new admission from outside or they're being transferred from somewhere. They develop a cough, they spike a fever, we have to test them. Everyone has come back negative. So it says a lot about the way that they're doing things. Maybe they need to look at different symptoms to warrant testing, since tests are so scarce, per se. But even still, that 24 to 48 hour window that they're given for results, if I'm admitted in the hospital, I will have my results within 4 hours, top. So I guess it would be your personal, if you develop a cough, do you feel like you need to go in? But there are people who, if you develop a cough, you should go in. Diabetic, people who have cardiac issues, patients who have other respiratory issues like asthma, COPD, emphysema, patients, our oncology patients, cancer, leukemia, any of those type of patients, yes, go in if you develop a cough because you're easily prone to developing this disease if you're exposed. People gathering. Unfortunately, I attended a gathering, but it was because my aunt passed. So I want to be there for my family, but at the same time, I'm like, I can't, I can't expose myself, and then I don't want to be exposed.
Right.
You have to pick and choose your battles when it comes to whether you are going to run with what the media is telling you. I saw a meme yesterday where there's a guy recording a news reporter. The news reporter is in all this PPE. He has on the monkey suit, the glasses, the gowns. I mean, he has on the full everything, but the news reporter is standing there just recording the camera, recording them. So it's like, do they use that propaganda to scare people? And it's possible, but you have to know your risks. Know your risk is all I can tell you.
Right.
But if you develop a new cough, take your temperature. Anybody can go to Rite Aid, Walgreens, Walmart. Even if you have children, you can use the baby thermometer just to take your temperature.
Right.
That's the first thing they're going to do.
So let me ask you this. They have been reporting that the numbers in African-American communities are super high, and it's just spreading very, very quickly, and we need to take extra precautions. Is this a part of propaganda, or are these true statements? Because, based on what you've been seeing just here in Cuyahoga County, those numbers sound much lower than what we've been hearing and seeing on the news. So where do you think all of these statistics for our community is coming from? Like, why do you think that they're saying that these numbers are high? I know in Detroit, I know in New York, in certain areas like that, they have really high numbers, but are they basing those statistics on those areas, or are they getting it, across the board from all of the urban areas?
So I have yet to see a breakdown of statistics based on race.
Okay.
I haven't seen any of those numbers myself, but just knowing things in nursing, who are more likely to not go to the hospital, who has that lack of health care, who are non-compliant with doctors' recommendations. We have to look at those things. That will make you prone to developing this condition. Who has more cases of diabetes, chronic kidney disease, heart disease? The African-American community. That's my take on it. That, those numbers are going to be higher because those are the patients who are more susceptible to becoming ill. Even if it wasn't the coronavirus, it could be anything else. Just because those statistics are there for us. We are part of the vulnerable population, African-American patients.
Right.
We are known to not have adequate health care, the underserved and underinsured. We are one of the highest groups for that. It just goes to being vigilant and adamant about getting your health taken care of.
Right.
Lack of health care, there's too many places where you can go be rated. Metro Health is a county hospital. They won't turn you away. And even if you work, you can be rated through their financial system. UH and Cleveland Clinic has the same thing, but they're private sector, so they want their money. They want their money.
Of course.
Any veterans, if you guys know any veterans, most veterans can come into the VA and receive free health care. And they won't even have to do the Medicare or Medicaid application. They can enroll in TRICARE, which is designated specifically for the veteran population. It's just taking advantage of resources. You have to attend those free health fairs that they offer in the spring and summer months. You don't have to enroll in that health system. It does a lot. CareSource does a lot. And is it Ohio Buckeye or the Buckeye Plan? All of those health insurance companies, they provide a lot of health care fairs. And so, nobody.
So
people are
where can we find this information? Like, I know everyone has a smartphone. Almost everyone has access to the libraries. But I know it's all about just going and being proactive and researching this information. Do you think there's other ways? I mean, besides doing what we're doing right now, what other ways do you think that we could help people in our community be more interested in getting this information and actually going to the doctor or utilizing this information? What are other ways that we can distribute this to them and say, hey, you can get health care by going here. You can sign up for this. What are some ideas that you have that we can distribute this information a lot better to our communities?
So what I'm a member of Black Nurses Rock Cleveland, which is a chapter under a national organization called Black Nurses Rock. And we do a lot of community work where we go to different health cares. The Northeast Ohio Black Health Coalition, I believe that's what it's called, with Ayanla, I can't think of her last name. She's great. She does many programs throughout the year. It looks like she has something every season.
Okay.
We have to be seen, number one. They have to see people that look like them to know that, okay, this is something that I can be a part of. If I go somewhere and I don't see anybody who I can relate to, I think this has nothing to do with me. Not me personally, you know, someone who doesn't take advantage of that. But I did come across a really nice website called www.healthycle.org. I went on there this morning just to look around and see, and it provided different links for healthcare companies. It gives different information about how to read healthcare bills, how they feel like this is not a bill, it's more like an expenditure, like an explanation of benefits or something like that. It has a lot of resources for people, and those resources are specific to the Cleveland community.
Okay.
It's not for any particular region or anything. It is designated for residents of Cleveland.
Okay. Well, I will make sure that we include that in this video. I'll make sure the replay, the links and everything are available, so I'll get all that from you. So I really appreciate you sharing your expertise and actually giving us the numbers that you're seeing in our areas and giving us the numbers, the actual numbers for Cuyahoga County. And just because those numbers seem low, I really don't want anyone watching this to say, oh, well, I shouldn't take any precautions. I shouldn't, you know, protect myself. I should just go out here uneducated and just do what I feel is best.
Definitely not what we're going to do.
I don't. Right.
You still should. They say use hand sanitizer. If you find it, use it. But if you use hand sanitizer, use it 3 times and then wash your hands. You should never just keep using hand sanitizer without some soap and water contact, because all it does is cover any germs that are on your hands. Wash your hands with soap and water for 20 seconds. If you don't want to count the 20, sing the alphabet song. That's 20 seconds. Right. Cover your face. You know, you have to protect your mucous membranes, because that's how it's going between droplet and airborne precautions. Airborne is why they're extending this social distancing, the 6-foot distance. Because if I sneeze, it can travel up to 6 feet. But droplet precautions, that means if someone is close enough, speaking, talking, yawning, anything, you know, and it get in my eyes, it can get in my nose, it can get in my mouth. That's how this disease is being transmitted.
Right. So do you have any information for us in regards to the masks that everyone's making right now? Because they're saying that, you know, wearing gloves and wearing masks are ways that we can protect ourselves and others, even if they aren't filtered, even if I think it's the N95 mask. Is this something that we should be doing, even if it isn't the N95 mask? Is covering our mouths with the mask that people are making, is that preventative, or does it not make any sense to do that at all?
If you can get a mask that's filtered, that's better than just a regular cloth mask.
Right.
But in healthcare, we are using, well, not we, because my floor, they've taken all N95 off of my unit because we're not doing any COVID patients at all.
Okay.
We have, I don't know, I'll send you the picture, but yesterday I had to put on what they call a PAPR, and it looks like a spaceman helmet, and it seals everything in, where I don't have a lot of contact with patients breathing around. But again, the mask that we use for airborne, which is what we should use, but because we keep transmitting droplets as well, we should also wear a face shield or like goggles. As far as the mask is keeping it with me. It's not, it doesn't get out. So that's why they say everyone should wear them. Because if you're infected and you don't know, you don't want to go around talking to people and then it's accidentally transmitted that way.
Okay, there was a lot of static coming from your mic, so I'm just going to try to reiterate what you were saying. So basically, we should be wearing the face mask, or you think we should not be wearing the face? I mean, you think we should be right now?
Yes, yes. I would take your mask just to cover yourself.
Okay.
We cannot assume that everybody is negative. But some people are carrying of the disease where it's
really, really important. That's the one thing that I wanted to ask was about the mask, because a lot of people were saying we don't need them. If they're not filtered, it doesn't make any sense to wear them. So, I just wanted to get your response when it comes to that, so we can get the right information out to everyone to let them know, yes, you should be wearing them, and yes, they do work even if they aren't the filtered ones or the N95 masks. So I just want to know, from your standpoint too, are they telling you guys how long we should be wearing these, or how long someone is no longer contagious if they were already diagnosed with the coronavirus?
Well, I don't have any of that information because we haven't had any positives on my floor. If a patient if a patient is positive, it hasn't been someone who I've been taking care of, and they're immediately moved to the COVID unit. I haven't talked to anyone who's been positive or, anything like that, so I really can't speak to how recovery and reinfection could be, because we can't say that you won't get it again. It's not like chicken pox or something. So at this point, it's so many updates coming. My management team is literally in meetings all day, and every hour they're coming back telling us, okay, we're not going to do this, we're going to do that. We're not going to do that anymore, we're going to do this. Okay, we're no longer doing any of that, we're going to do all of this. So it's like this is all stuff that we're learning as we all go because it's new.
Right. Well, I appreciate the information that you did give us. It just seems like this is something that we have to just continue to pay attention to focus on. I know that everyone doesn't have an AV that they can go and talk to, because I know that a lot of nurses have been, posting videos, and it's been shown that some people aren't posting the right information. And again, as I said, I just wanted to have you on because I wanted to make sure that we were distributing proper information. We weren't distributing propaganda or scare tactics or misinformation and things like that. So I really appreciate what you have given us, and I do understand that it's just as crazy for you guys as it is for us, but the information that you have given us, I really and truly appreciate that. So we're going to move on and give you a bit of a breather. So we're going to move on, and I was going to go to Christy, but she's not on right now. So we're going to move over to Kay, and so she's a mom, and that's one of the other reasons that I wanted her to come on and talk to us and just let us know how things are going for her, and I know that she's had some people in her community that have been affected by this as well. So tell us from a mom standpoint how this has affected you and your children, and how, you know, you have smaller kids. Like, how has it been explaining what's been going on to your kids?
It definitely has them unmotivated as far as schoolwork and, you know, just staying focused on still doing schoolwork, still taking care of business, still waking up in the morning and trying to keep the same schedule, all that kind of stuff. I had to think about my actions and, like, basically what I was, how I was reacting to everything. I had to think about that and really show them, like, we still have to stay focused. This is not the end of the world. This will be over with one day. We don't know when, but it will be over with. And we still have to focus on our future. So I'm trying to, you know, make sure that they're still sticking to doing some schoolwork. Obviously, we're not having them do schoolwork for 8 hours a day, but every day, you know, I got them doing something. And then they're earning their video game time, or they're earning their outside time and things of that nature. And ways I'm keeping myself sane is basically just focusing on a lot of things that I always wanted to do had I had the time to do it. I've been watching TED Talks. I've been watching live seminars on, you know, how to get an 850 credit score, just a whole bunch of things that we all want to do. But we're so busy every day that we're not able to really focus on that. I'm going crazy as a mom, staying in the house all day, every day, because I'm barely working. But it's, to me, I have a son that's about to be 11 years old, and I know that's still kind of young, but kids his age and a little bit older get so discouraged with stuff like this, especially if us as parents are acting as if this is the end, you know, or acting as if this is something that, you know, we're freaking out about. So we have to be careful about the things that we're saying in front of them, and all of that stuff. And what's really important is that I feel like we really need to focus on any youth that we're connected to. I'm sorry, I'm like, the camera's on going crazy.
That's okay.
I feel like we really need to focus on any youth that we're connected to, like especially teenagers that are in high school right now. You know, in Cleveland, our dropout rate has always been, you know, kind of high. You already know in our neighborhoods, our youth is always really high risk of getting into trouble or doing things that could potentially ruin their lives or make their lives a lot harder than what it needs to be. I think it's really important that we need to stay in contact with any youth that we're connected to, and just speak life into them and keep them going, letting them know, like, listen, this will be over. Stay focused on school. Stay focused on doing all the things that you planned on doing. I live in a pretty rough neighborhood, and I'm watching these kids just click up and they're walking around bored. And a lot of these people are judging them. You know, they're saying, oh, they're about to go out here and do something stupid. And we need to stop acting like that towards our youth. I think that's, like, really important, that we need to really pay attention to them. And, I mean, they've already taken down basketball hoops. You see what Scene said. They said that Cleveland took down the rim so that these idiots could stop playing basketball. Like, why are we calling them idiots? You know what I mean?
Right.
Why are we treating them like that? And that things like that is causing them to get into more trouble. Because if we're acting crazy, how do you expect them to react about it? You know?
Exactly.
So I think it's really important that we really stay connected to. I have nieces and nephews that are older, and they're really discouraged. You know, a lot of these kids are not getting proms, they're not getting graduations. There's a lot of things going on that'll make a kid really feel like, okay, I don't even want to try anymore. So that's why I wanted to join the conversation, because I think that we really have to really, number one, set an example for them, and number two, really just speak life into them, get them focused on things that, whether it's just schoolwork or whether it's something that's identifying what they want to be when they get older, where they see themselves being, like, let's focus on that and let them know, you know what, you guys are our future. You guys are the next people running this world, you know, so we have to definitely keep their minds right, because us grown people are going crazy with this, you know, and we're not even thinking about how crazy, like how the kids are looking at us like, okay, if they're going crazy, how are we supposed to feel about this? So as a mom, I feel like that is very important for us to do.
Absolutely. And I think that one of the points that you touched on when you said right now we have this time, I know there are people that still go to work, that have the essential jobs, but I think right now is the time to take this free time to, and I'm doing the air quotes for a reason, to figure out what we can do to help our youth right now, because we have the time. I know a lot of times we're like, oh, I don't have the time, I'm doing this, I'm doing that, because a lot of people are working, you know, more than one job to take care of their family. Not everyone has a single-parent household, but some people do have single-parent households, and I think that this is probably the only time they've had this much time on their hands to actually focus on something other than work. So with the reports coming out and saying social distancing, stay home, you know, don't be around other people, and this is for you and anyone else that wants to answer this before we get to Garbs, but how can we find ways to keep these kids encouraged, keep them busy, but social distance at the same time, and make them understand how important social distancing is? Because it does seem like a lot of young people don't think that social distancing is important right now. They don't think they can get sick. They don't think that being in the house means anything, and we want them to understand how important social distancing is, but we also want to keep them encouraged, especially the ones who aren't going to have a graduation this year or aren't going to have a prom. Like, what are some ways that you guys think that us as adults can come together to do some things for them? Do you guys have any ideas on that? I know Avi was saying wearing the mask is important. You know, washing our hands is important. What are some ideas that you guys might have that say, hey, maybe we can do this? They said that we're opening. Go ahead, Garbs.
I interject. You know, one thing I'll say is that with, you know, everybody homeschooling and all that, I'm pretty sure that a lot of parents are understanding the challenges that teachers have to go through nowadays.
Yeah.
You know, and I think that that can actually, moving forward, can enhance the educational process once everything does open back up, because now parents are going to be paying attention like, okay, well, I saw how you were acting a little bit, so let's start over. Let's do something different once you go back to class. Now, when it pertains to the kids trying to keep them busy, create crafts, create activities. One thing that I think in a lot of cases that happens nowadays is that we stifle kids' creativity. So we're talking about the importance of masks and social distancing, then create some sort of activity for the kids, no matter their age, to create their own mask. Yes, okay, the filter masks are definitely going to be the go-to first if you have access, but you know, as we know, just with the companies that are selling them, most people don't have access to it. So at least create something that, you know, that can go along with something that the kids like, whether it's sports, music, whatever it may be, anime, that can create a mask that is important, that includes something that's important to them.
Right. Okay. I think that's a really great idea. But since you're speaking, Garbs, I know that I invited you here to I know you don't represent all of the hip-hop community, but here in Cleveland, you represent our hip-hop community. Like, you're one of the OGs of our community, and a lot of people respect you and look up to you. And what are some ways that you think the hip-hop community can be more involved with getting out information that our communities need? Like, AV was giving some links to different resources and different events, but a lot of times we don't hear about those events. what are some ways that you think the hip-hop community should and could get involved with, like you said, activities, spreading information about healthcare, spreading information to get out the right information instead of the propaganda that's being spread? Like, what are some ideas that you think that we could do better as a hip-hop community?
Well, first and foremost, one critique that I have on a lot of people is vetting where they're getting the information from, because a lot of times, a lot of these websites and stuff that, people are sharing, number one, they're only looking at the headline other than the meat and potatoes of the actual article that they're sharing, first and foremost. And we have to sharing a lot of propaganda and a lot of, unproven conspiracy theories. And I understand the basis of a conspiracy theory is, of course, they're not going to try to hide. Like, I hear a lot of stuff about 5G and all that. But, one thing that I'll say towards that, I don't want to really truly get into that conversation because that's a long one I have issues with. But number one is that does anybody really think that these huge multi-billion-dollar corporations need the virus to happen for them to put up 5G towers? Like, they don't need this to be happening to put that up. It's mind-blowing to me that people are going towards that. But anyways, I think that really vetting the information that they're putting out there first and foremost, and actually reading the articles is first and foremost the most important part of the information that they're sharing. And number one, what we have to make sure that we do is stop spreading fear. And there has to be hip-hop artists, DJs, promoters, all these different entities. People have to make sure that we're being responsible with the stuff that we're putting out to the public, because there are people that respect us, that look up to us for advice or guidance or whatever it may be. So we have to be responsible with what we're putting out there. If we're just putting out a lot of nonsense, a lot of fear, then that's what we're going to get. That's what people are feeling. So I think it's imperative that we really just got to be a lot more responsible with what we're putting up. Now, there are a lot of people that are putting up positive stuff. And one thing that I'll say too is what I started doing without feeling bad is start muting people as well as unfriending people if they putting out a bunch of garbage on the internet. Like I don't want to see that. I don't want to see a lot of BS on my page. Like, I don't care if I've known you for a while. Hey, I wish you the best, but putting out a lot of stupid stuff and a lot of nonsense that's not actually factual and based off of facts, I have no will to actually see you in my timeline nonstop.
Absolutely, and I agree with that. I am a habitual muter and a habitual unfollower and a habitual blocker. Like, I have no problem with muting, blocking, and unfollowing people because I just don't want to see that in my timeline, and I have no hard feelings for doing that because I think that the other thing that we have to focus on right now is everyone being in the house has caused us all to be on social media probably way more than we have been when we were busier. And social media affects your mental health just as much as the news affects your mental health. And for me, I just don't want to constantly see ignorance in my timeline. I just to put it simply, I just don't want to see ignorant conversations and seeing 10, 20, 50 other people agreeing with your status update. And I'm just thinking, how could you possibly agree with that? Like, how does that make any sense to you? And I know that some of you guys are at home homeschooling your kids. So now you're raising kids to grow up to be just as ignorant as you. And I know that ignorance, you know, you can be ignorant. Just because you're ignorant doesn't make you stupid. Where the part that brings in the stupidity is when you are willfully ignorant. So then that makes you stupid. When you choose to not research, when you choose to not ask questions, when you choose to not want to get the proper information, that's when you become stupid, because now you're choosing to be ignorant. You know, you can be ignorant and didn't know that you didn't know. Like, you don't know what you don't know until you learn. But once you've learned and you choose to still be willfully ignorant, that's when it becomes stupidity. So I agree with you, Garb. Like, I want to protect my mental health.
Well, that's the very thing. And you know, what I'll say is, with a lot of people that are pushing the conspiracy stuff, you know, it's like, oh, do your research, but, you know, it's only following back to unvetted presenters of information, or it's one YouTube clip that they've watched, or, you know, we just have to be more responsible. And like, I don't think that there's anything wrong with just wanting to see some positive stuff. Or not even necessarily positive, because, you know, I know it's very hard for a lot of people to stay positive during this time period, but just facts. Facts are the only thing that matters when it pertains to what's going on in our circumstances right now. So, you know, one thing that I try to do is just on my pages is try to put up something inspirational, try to put up something positive or factual, or, you know, something that can maybe help people occupy their time a little bit more or a little bit better than the 1,000 other people on your friends list that are putting up a lot of BS.
Yeah, and I think social media has caused people to, I think this whole, like, we've become a culture of, you know, when people put up a status and they'll say something that's the opposite of what they know people believe and feel, and then they'll say, let's argue. Social media has made people care more about arguing than actually just getting along and having a proper conversation, because what's wrong with putting out, let's just say Amy put out the link to all the information that she gave us and said, hey, let's discuss this. And people can say, hey, I didn't even know about this. Thank you so much for sharing this. And they tag someone else. They say, thank you for this information. I feel like social media has made people want to argue and put out misinformation for the sake of causing an argument on their page. And then they'll say, well, do your research. It's kind of like, well, if you're going to present me with improper information and then say, do my research, you are a part of the problem, because you know most people aren't going to do their research. So why not just put out the right information first? Because that's what most people are going to read first. Put out the right information first, and then say, and which is what I normally do, you know, and we do at the radio station. I always preface things and say, here's what we have gathered. Please do your own research. Don't just go off of what we post on our social media pages. Don't just go off what we talk about in our radio station. Here's some proper information that we've learned about this topic, and we suggest that you continue your own research based on what we've given you. But I know that that's not something that we can stop just with this this panel, but it is something that I would like to encourage people to do. I know that it's more fun for some people to argue, because then I don't know, I can't speak for those people.
They gain the wrong attention. They're seeking attention.
Pretty much.
Yes.
You know, everybody nowadays is an expert. Everybody wants to, like, act like they're an expert, and it's like, you know, there's
and be the first one to know, right?
Yeah, it's like, you know, there's people that actually have degrees in this stuff, so maybe we should listen to them first. You know, but here's what I will say is that, of course, we can't change the entire dynamic of the internet and social media right here on the panel, but there may be the viewers that do see this, and it may make people think, and make a handful of people say, like, you know what, let me not do this today. And as long as we, as some responsible adults, can actually, like, do that and maybe change, may change 10 people. You know,
Right.
we change 1,000. You know what I mean?
Right.
And you never know. But as long as you can do that and push that narrative forward a lot more, then that's the only thing that matters.
Absolutely.
Right. I
And
think
that's
the biggest
really
problem.
what.
Go ahead.
Oh, go ahead, Kay. Go ahead. I'm sorry.
I was gonna say I think the biggest problem with this is that none of us really have the facts. Even, even Avi, we don't have the facts. The doctors don't have the facts. So everyone's trying to act like they know, and it's like none of us know what is going on with this. And therefore, it's like taking the information, consider the fact that it may be wrong, it could be right, but let's stay safe. Let's still follow the protocol. Let's still wear the mask. Let's still wash our hands and keep the social distancing and all that stuff. But so many people think that they know what they're talking about. They're not doing these things, and none of us know what's going on. You know what I mean? So, and I feel like it's so important for us to kind of take in that information, but then focus on positive things, because one of the main reasons why urban communities have such bad health is our mental health. It starts with our mental health. When I'm a single mom, a lot of people are single moms. A lot of people are on welfare. A lot of people are working for way less money than what they deserve. And then, with the Black community, you guys go through way worse than just those issues, with the racism and all that other stuff. So one of the main reasons that urban communities are so unhealthy is because of the stress. I'm a diabetic, and I'm only 30 years old, but I'm a diabetic because of the stress that I've been through my whole life. I had a very, very rough childhood. So just being stressed out and going through things that I've been through caused me to get diabetes at a really young age. It caused me to have a lot of health issues. When you're stressed out, that releases hormones in your body that are very bad for your organs and very bad for your kidneys don't work correctly, your heart's not working correctly. There's so many things that happen because you're under stress all the time. So it's so important for us to, yes, gather in the information so we kind of know what's going on, but take it with a grain of salt, because we don't, even though that all this information is out there, we don't know exactly what's going on. So take precaution, but then take your mind off of it. It's really hard to do that when you're in the house and you're not working and you're not doing, you're not occupying your time with a lot of things that we're used to. So that's why it's so important to watch things like TED Talk. If you're a person of faith, get in the Bible, pray, whatever. For me, I am a person of faith, so I do those things, but I also do things like watch educational videos to just expand my mind and really take my mind off of things. Like the other day, I literally was watching so much information to expand my mind. I forgot that this was going on. And that's what we need to do. We need to take our minds off of this, but still be responsible enough to know what's going on, And that's what I'm trying to get the kids to do. Like, let's focus on something else. This is not, we're not focusing on this all day.
Absolutely.
So,
and I know that our community, we know that we are a marginalized people. We also know that when we go to the doctor, we are less likely to be cared for the way that we are supposed to be cared for. There have been a lot of cases of Black women going to the doctor and they just don't believe us, because they feel like we are strong. They feel like we have a high pain tolerance. They think all these negative things about us. So when we go to the doctor,
and it has to do with money too. If you don't have money, they don't want to treat you. It's got to do with a lot of things.
Money really doesn't play that much of a factor when it comes to us, because Beyonce had issues when she lost babies. She had issues with the twins. She had issues when she was pregnant with Blue. She talked about this in an interview. I know Serena Williams, she had a lot of complications while she was pregnant as well, and she was saying how it was really hard for them to actually listen to her and listen to what she was saying was going on with her body. So she was discussing this as well. So there's been a lot of cases of people that have money that are going through the same struggles as Black people who don't have money. So I think that's also a topic that needs to be discussed. I know we can't go into that in depth during this panel because there's only so much we can talk about within an hour, but I know that I just wanted to bring that up because I know someone may watch this and they're going to bring that up as well. Like, we have so many problems within our community that we have to tackle and that we have to speak up on. So I feel like when we're talking about things on the internet and when we're talking about conspiracy theories and different things like that, let's bring up these things. Let's bring up the fact that we can go to the doctor and they not believe our symptoms. You know, I think that a lot of
they know it's real, but they don't want to treat it.
And that's what I'm saying. Yeah. And I think a lot of the reason that these things are still going on is because we aren't talking about it. We aren't making these topics go viral. You know, we aren't bringing this to the forefront to say, hey, we know what you guys are doing to us and we don't like it. We've all had this conversation and now we're coming together to speak out about it and we want it to change. And I see Abby shaking her head in agreement. And I want you to, speak on this because you work in healthcare. So go ahead, Abby. I'll give you the floor.
Not even as a healthcare professional, from a patient standpoint, you have to be able to say, look, this is what's going on with me. You can minimize it, but I'm telling you this is what's happening with me. And you are going to do this about it. You're trying for an hour. So we're going to take up this whole hour. My visit may have only been 15 minutes, but we going to figure this out. I'm not leaving without you telling me, giving me a referral, you ordering an exam, you ordering labs. I'm not leaving without that. That's what we have to start doing. Because if they tell you, oh, no, it's okay, and you were like, oh, okay, you can't let that go. I went with headaches for a long time. Oh, it's your blood pressure. You check my blood pressure isn't high. Something is wrong. I'm telling you, something is wrong with me. And I have migraines. Okay, thank you. But it took, not neurologic studies, but, me saying it's not my blood pressure. I can prove to you that it's not my blood pressure. I'll change my diet if that's what you want me to do. I'll change what I eat, what I drink. I'll decrease stress. I'll do everything you need me to do, but I'm going to show you that I still have this headache.
Right.
To be able
I think that I think we also have to understand that if it weren't for the patients, the doctors wouldn't have a job. And we have to not be afraid to be advocates for ourselves. I think when people go, first of all, people are afraid of the doctor. But not only are they afraid of the doctor, but I also think that people don't know, and I know that this might sound weird. I think that people don't know that they can actually speak up and tell the doctor what they want. I don't think people know that you can ask for these things. I think because the doctor is so prestigious and you're taught they know everything, they have this degree, I think a lot of people aren't aware that they can actually speak up to their doctors, not being rude, but I don't think people realize that they can actually tell their doctors what they want and ask for what they want. I don't think people know this.
With that being said, let me say this. I was diagnosed with type 2 diabetes last year. They diagnosed me before my A1C was even high enough for me to be considered a diabetic. I'm actually pre-diabetic, but they diagnosed me. They gave me a prescription of metformin, which is what you take when you're at the beginning stages of diabetes. They gave me the prescription. They gave me all this rundown of what I need to do, and I'm like, I told him, I said, you know what? First of all, I'm not diabetic yet. I'm pre-diabetic, but I understand why you're trying to treat me as a diabetic because according to you, I will become one, and it's just going to progress, and it's going to get worse. This is one of the reasons I wish Rome would have called in, because he is somebody that actually was helping me with the natural cures and stuff. Matter of fact, he's calling now.
I'm on the phone.
Oh, okay.
Oh, you're on the
hi.
phone. Okay, my bad.
It's over now.
So with that,
we've been on
with
here
that
for
being
hours.
said, I didn't know you was on the phone. So with that being said, I told my doctor I'm not taking the metformin. I'm not taking
Y'all
it.
like on FaceTime or something?
You know,
Go ahead.
mental health, which is important. But one thing that I'll say, you know, just from my perspective, is I think that physical and mental health are one and the same. So,
Those
you know,
are the most important.
a lot of things that we need to make sure that we do should be preventative. So I am into holistic health as well, you know what I mean, taking supplements and things of that nature. I mean, last month in March, I ate 100% vegetarian. I didn't have one piece of meat in March, and I ended up losing 20 pounds in combination with working out.
Right.
So, you know, a lot of the things that we have to make sure that we do to protect ourselves from this thing and other things that potentially can happen is we need to make sure that we eat healthy, and we need to make sure that a lot of the things that we're used to eating may not be good for us. A lot of processed food. We need to eat more natural foods. We need to eat more vegetables, eat more fruits that aren't processed, that aren't wrapped up in, you know, and packed with sugar and GMOs and all that type of stuff. We have to eat healthier. And then, you know, hopefully with that, it would have some sort of positive effect in arming our bodies and arming our temples to protect us from, you know, things like COVID-19 and other things. But also that can tie into our mental well-being as well. Because if you're eating a lot of garbage, then, you know, I'm a pure...
You feel like crap.
Yeah, you feel like crap. It's like, so like the whole... you know, after holidays, we get the itis. The itis, that's not good. That's not positive. You know, even though the food is good, it's just not a good thing for us to actually feel that. It's not supposed to. It's not natural. Food should actually make you energized. It should make you feel good. And if you don't feel good from what you're eating, then it's probably a good idea for you to begin to, adjust what you're digesting into your system.
Right. Absolutely, and that's something else that I wanted us to talk about too on this panel is our community and everyone that lives in our community is to advocate for businesses that offer more and healthier options because like Kayla was saying, you know, in her neighborhood, like she's a single mom, she lives in a rough neighborhood, you know, I'm pretty sure there are other people in her neighborhood that may be the same, you know, single moms. Like she said, there are people that are on welfare. But, you know, if those are your circumstances and you don't have a car and you're relying on public transportation or you're relying on the stores that are closest to your house to provide the food that you spend your food stamps on or that you purchase for your kids, you know, healthy, then you're going to eat those foods that are the closest to you. You know, if you are a single mom and you're just trying to feed your kids because you've been at work all day and it's just you and you don't have any assistance, you're going to stop at McDonald's, you're going to stop at the plaza, you're going to stop at the quickest, easiest thing that's around you. So that's something else that we as a community have to advocate for, and that's advocating to have more businesses in our areas that offer healthier options so that the only option that you have isn't processed food, you know, liquor from the liquor store, food from the gas station. Because if you think about it, if you drive through an urban area, you don't see Giant Eagle. You don't see Whole Foods. You don't see Heinen's. You know, you really don't see a Starbucks. You don't see any of these things. But you see convenience stores. You see plazas with fast food version of Chinese food. You know, there's all these fast food places when you drive through urban areas. But when you get past the urban area, then you start seeing Whole Foods, you start seeing Trader Joe's, you see a Heinen's, you see all of these, you see smoothie, their fast food restaurants consist of Chick-fil-A, smoothies, places that actually serve you healthier food options once you get past the urban areas. So we do have to eat healthier, but at the same time, we have to recognize that a lot of people are buying what they can afford and what's close to them, and what's closest to them are unhealthy processed options. So it goes back to what I was saying about being more demanding when it comes to proper health care. We also have to be more demanding with the type of businesses that we allow to open up in urban areas.
If you stop buying it, they'll stop bringing it. Right.
You have to be more you
there?
business in my area, because if you live in like Cleveland Heights or Shaker or Beechwood, any of those areas, they have no problem with telling you, I don't want this in my area, which is why it took so long for Cleveland Heights to get fast food restaurants. They literally had an ordinance that wouldn't allow McDonald's or Burger King or any of those type of restaurants to be built in their neighborhood. And if you did, it had to be on the outskirts. So we do have that power. You have to talk to your council people, go to town hall meetings. The same way we go to clubs, we have to go to town hall meetings. We have to know who our council people are, and we have to let them know what we do and don't want to see in our neighborhoods, and say, I'm tired of just being able to go to a fast food store and feed my kids. Like, where are the fruits? Where are the vegetables? Where are the healthy options?
So here's what I'd like to actually say, though, and I don't know if it's common knowledge, but a lot of these stores, a lot of these convenience stores and all that accept, like Wake and Snap and things of that nature, they're required to keep a certain amount of fresh food on deck. And if they don't have that, then they're actually not compliant with the program. So that is something that you can bring up just legally to your local government, that they're not providing what they're supposed to. Because in order for them to qualify to accept these programs, they actually have to have that. I don't know the exact law. I'm not going to act like I'm the professional on that, but that's one thing that I did learn.
And we also have to buy it, too, because if you go to stores on the outskirts, it could be the same store. It could be a Dave's or a Giant Eagle. They have low sodium options. They have all these healthy options that the stores in the hood don't have, because nobody wants to buy those products. They're not in demand, so they're not going to, put that in. They're not going to order those things because it's not in demand. So that's what we have to change. We have to change what we're buying. We have to change what these stores are going to order for them stores. If we're not buying the unhealthy options, they're not going to keep selling it. They're not making money anymore. So we have to raise awareness of. Go ahead.
Oh, yeah. No, I was saying I'm glad Garbs brought that up, because it goes back to what I was saying. You don't know what you don't know until someone tells you. So the fact that that's something that we can demand from our stores, along with what you were saying, Kay, but Garbs, if people don't know that a store is supposed to offer a certain amount of healthy options if they accept WIC or SNAP, if people don't know that, they can't demand that. If people don't know that these stores are breaking the law, then they can't demand that these stores stop breaking the law. It goes, I know this isn't really on that, but it's just like, in stores in the urban area where they say you can't use your card unless you're going to spend $5 or $10. That's against the law as well. So there's a lot of things that they do that are against the law, but they do it because they know that they're in an area where people just don't know. And they can get away with it. So again, that's the reason that I had this panel and I put it together, because I wanted us to talk about different things like what we're talking about right now. And I know that the title was Beating the Coronavirus in Our Community, but to me, I feel like the coronavirus can be anything. We could be beating diabetes in our community, beating unhealthy eating habits in our community, beating mental health in our community, the coronavirus could be interchanged with anything that's affecting us right now. And I knew that bringing the people that I brought on this panel, it would give us different bits of information that people probably weren't aware of, so that we could spark that discussion, like Garb said, even if it's just 10 people, or, you know, it could go from 10 to maybe 1,000. Right. I just wanted us to give people things to think about, and I wanted to give them pieces of information that they probably weren't aware of before, because the best thing to do when you go into a fight is to actually have knowledge, especially when you're going into a fight like this. They're not going to listen to it, and they think that you are.
Like,
if you aren't aware or you don't know, then, you know, it kind of defeats your argument, because they can fight you with their knowledge. So we have to go into the fight with more knowledge than we had before. So I just want to thank you guys for taking time out of your day. I know that most people's Saturdays are really, really busy, and even if you aren't working, it's still most people rest on their Saturdays, and I know AV, this is your off day, so I really appreciate you for being on here today. Rome, we started so long ago, but I still want you to introduce yourself and tell everybody who you are and what you do. I really wish that you were here for the full conversation, but since you're here, I want you to introduce yourself.
Yeah, I was playing a humble card. You know, I wasn't on time due to a whole bunch of complications, but I was just listening to y'all. But my name is Rome. I go by Young Rome, Uptown Rome. You look me up. I'm from Cincinnati, Ohio. Currently in Augusta, Georgia. I do music. I'm a trainer. I work. I'm a single father. I'm an impact in my community, man. I've been through a lot of stuff, seen a lot of stuff. You know, everybody got their own little story. So if you look into it, you might find it interesting. But I also have a lot of knowledge on the topic as well. You know what I'm saying? I don't know what I missed out on, so I was really trying to listen to everybody's points and views. And I hear a lot of strong points. I hear a lot of stuff that makes a lot of sense, and it sounds dope. It's encouraging, but I feel like, you know, first and foremost, like, we really have to take charge in what's in our community, but we have to start within the home before we look down the street, before we look down to the next state or the government or anything like that. We have to start in the home where we actually control what's being taught to our youth. Once they're outside the home, even though we talk a lot about, you know, the stuff that we need to be doing, they have more access to stuff they shouldn't be listening to and shouldn't be following and being fed different stuff at school. So we really got to start within the household and not even expect companies that pretty much thrive off of our lack of knowledge to even change what's been working for them for centuries. A lot of these companies and businesses have been passed on and on and on, and it's not going to stop. No matter what we say, we have to start within the home and really start teaching ourselves and our youth about what can keep them healthy. Because in my opinion, the coronavirus is, you know, people can say it's 5G, people can say, you know, it was man-made, the government had something to do with it, but I feel like it's so many more illnesses and things that's tearing our communities apart. This is just another one of the government's, whatever you want to call it, wrecking balls that they thrown into the pot. So it go all the way to mental health, lack of knowledge, lack of education, poor dieting, not exercising. We definitely got to get these kids off of these video games and back outside, back being active, get back to home cooking, and actually treating the body. You know what I mean? Because every single time you put something into your mouth, you either feeding a disease or you fighting it. It's either or. You're never doing anything outside of those two. You know what I mean? So the time you say, yeah, we should be doing this, doing that, the time you pick up a Pepsi, the time you pick up a piece of cake or anything, you totally going against what can keep your body just, you know, in an alkaline state. So, and ain't none of it perfect. I went and bought some crab legs this morning. So ain't ain't nobody perfect, you know what I'm saying? But we definitely have to strive to like make the impact in our homes first. Let's start in our homes. Let's start on our streets. Let's start there. Let's start. Yeah, let's start with our community and actually get involved with the community and not just going to vote. Like, you're actually more powerful. Not voting and telling them to come holler at you. You know what I mean? But it's gonna take a collective group. It's gonna take everybody to be on the same page, and that starts with action. And leading first. Like I mean, the knowledge is out there. It's actually way more fruitful than it's ever been. You just got to tap into it. But it starts within the home first, man, because I feel like if you throw your children or your family members out in society, it's not going to be in their favor. You know what I mean? You can tell them anything. You know what I mean? You can tell them anything, and they can create anything. They can create any type of vaccine and medicine and all of this different stuff. And so, you know, I don't know all of what I missed, but it ain't even really Corona that got me interested in our community. It's that, along with the violence, what's being promoted in the music, what's being promoted in the videos, what's being taught in the schools.
Absolutely.
So they're actually programming our kids to fall in line and work for somebody else for the rest of their life, or go to prison. It's like a tunnel. It's like a tunnel that is never been proven to work for any of us. You know what I mean? I don't know anybody that's ever been rich or wealthy off of a 9-to-5. I haven't met one yet to this day. And I just feel like starting within the home and getting into business and growing your food is big. Growing your own food is big. You know what I mean? Start with your house. Start with your home. You know what I mean? And especially times like now, because even if you do put the pressure on some of these companies, like, hey, we need more fruit, we need more vegetables, like, it's all about money to these people. They got tomatoes that's bigger than our heads now. You know what I'm saying? Like, they can put stuff in there to make you think you winning, but the stuff they putting in some of this stuff is stuff that they put over these crops to keep bugs off of them. Some of them got pesticides inside them. Now, you know what I mean? Like, as they grow, they have stuff that's in the fruits and vegetables that will keep bugs from destroying the crop. So you might be getting you try it one day. Go to Walmart, take a tomato and take a Sharpie and mark your initials and the date on the bottom of it and sit it in there and come back about 2-3 weeks later. It's probably going to still be there and still look fresh. You know what I mean? It's still, real tomatoes don't last that long. You know what I mean? Right. So it really comes in to start in your home. Each one teach one. You know what I mean? And it's easier to teach when you're actually doing it. You know what I'm saying?
You're leading by example.
Yeah, it's just easier. It's easier. And I'm learning as well myself. Like, I'm actually, like, kicking it with older people that have been through all that and actually, like, find peace in growing their own food. And it's like, damn, it's that easy. You know what I mean? I never was taught that.
Well, I know here in Cleveland, there are certain areas that have community gardens. So I guess one of the things that we can, just based off of what Rome was just saying just now, I guess one of the things that we could get back to is focusing and promoting the community gardens that we have in a lot of the urban areas and making it fun and getting the kids, especially now that we have time. I know they said that, you know, everything is going to go back to normal on May 1st, but I just don't want us to take these last 2 weeks and not utilize them to the best of our abilities. And it's us coming together. If we're going to do something, if we're going to come back together, I know there's going to be a lot of parties, there's going to be a lot of kicking it and different things like that, but I really feel like Rome was saying, if we're going to learn some new hobbies, let's get into gardening. Let's go and get into these communities because they're already out here. If you go down Superior, there's like 2 of them, but they've been neglected. So maybe that's something that we could get the youth involved in and let them know the importance of eating healthy, the importance of growing your own food. Because I know that when they first announced the coronavirus, everyone was running out and clearing out the shelves, and people were worried about there not being any food, and people were worried about, there not being any toilet paper and different things like that. But if we are confident enough in ourselves and our ability to grow our own food, then maybe the panic that ensued initially won't happen the next time, because we have our community gardens. We've learned how to be a self-sustaining community, so that certain things won't affect us as much as they have affected us before. So I want to continue this conversation. I definitely want us to have a part 2, because I feel like some of the topics that we brought up on this panel deserve to have a part 2. And I don't want to have you guys on here for too long. So, again, as I said, I appreciate A.B. for coming on and giving us her expertise from the healthcare perspective. I appreciate Kay for coming on as a mom and giving us her perspective as a single mom and what's going on in her neighborhood and the ideas that she has given us to help our mental health, our physical health, and things that we could do as far as the kids in the community. Rome, I know you came on a little late, but you still brought a lot of knowledge within the little bit of time that you were on this call. And you gave us some other ideas and things to think about, too, that we can do within ourselves and within our own communities. Garb, the OG on the call, our hip-hop expert, thank you so much for coming on and giving us your knowledge, thoughts, and ideas and things that we can do to help beat the coronavirus in our community, but not just the coronavirus, but mental health, physical health. And I've always respected your opinions and your thoughts. You were always the person on the team that always wanted to talk and always had a lot of stuff to say, so I knew that you would be perfect for this. So I thank you guys so much again for taking time out of your day, and hopefully all of you out there that are re-watching this, I hope you take something out of this and make a change, and I hope you take something from this and pass it along. And because when one person tells one person, that person tells another person, and like Garb says, it hurts to 1,000 people, and then that can turn into a lot more. I appreciate you guys for working through all of these technical difficulties, but it just is what it is. But you guys are here. You guys have no idea how much this meant to me. And I really appreciate you guys. I'm very grateful, and I hope you guys enjoy the rest of your Saturday, and hopefully you guys will help me in, with part 2. You guys let me know. Like, give me your ideas. You can send them to me on Facebook. Let me know your ideas, what you think the next topic should be, even if it's based on one or two of the things that we talked about today. Just give me your thoughts and ideas of what you think part 2 should be about. But again, I'm very, very grateful for you guys. And I don't know, if you guys have something that you would like to say in closing, you now have the floor to do so.
Can I say, I'm actually part of the Turntable. That's one thing I'm promoting right now.
Okay.
With, the homies Siege, Haiku, Jinx, and Speed, so folks can subscribe to United Grind and check out the new episodes of the Turntable on YouTube.
Do you have a particular day that you guys upload the episodes? Like, what date should we be looking out for, or should we just follow and subscribe?
So it's existed for a little while, so they've been doing it for a few months, longer than a few months, but the first episode with me on it is actually uploaded and it's live right now, so folks can go there after they watch this and check that out as well.
Awesome. Okay, A.B., you have any last
I want to write it down.
It's called the Turntable, but the YouTube channel is United Grind.
Okay.
A.B., do you have any last words that you want to say as we close out?
Just to put a little information out, as far as resources for the African American community or healthcare in general, not specific to the African American community, but like I said, the Northeast Ohio Black Health Coalition. They have a Facebook page, and I believe they're on Instagram. I'm not sure, but you guys can look them up. They have a lot of different resources available. They provide a lot of information. They host a lot of different events. Right now, no one is doing too much of anything, but she may do some virtual things. I know every September she do a walk with my sister, but it's open to everyone. All of the events are normally free. And it's very resourceful, provides a lot of information. Know that's something you guys may want to check out, or even the listeners may want to check out.
Awesome. Okay, thank you so much for that. And it's called the Northeast Ohio Black Health Coalition?
Mm-hmm.
Okay. Thank you so much for that. All right, Kay, do you have any last comments or words that you want to leave us with today?
I just want to remind people to really focus on our youth and focus on setting an example for them on how to handle this whole situation, keep them motivated, let them know we believe in them, let them know that we love them. Anyone you're connected to that's in high school, a young adult, just encourage them that this is not something that's going to last forever, and this is a crucial time to really stay focused on their futures and not do anything to throw it away. Because we have a lot of at-risk youth in Cleveland, Ohio, way more than, in Cincinnati, where Rome is from, even in Augusta, Georgia, where he's at now. They're everywhere. Every city has at-risk youth that we have to focus on. And the main problem is that a lot of people dismiss them. That starts at home with their own parents, and then the rest of the community, and that's why they kind of give up on themselves. So I feel like we really need to focus on that big time right now, while they don't have school or anything else to really keep them occupied.
Absolutely, I absolutely agree. Rome, you have any? I know you just spoke, but do you have any closing words for us? We're gonna have to do this again with you and have you on early. But do you have any closing words that you want to give us right now?
Yeah. First and foremost, I want to thank y'all for the opportunity and apologize for falling in kind of late again. So I'm looking forward to doing this again. Anybody got any questions or anything they want to holler at me about, I tap in my Instagram, Uptown Young Rome, my email, uptownyoungrome@gmail. And just in closing, to piggyback off what Kay said, I feel like no matter what, the results never going to change until we really take control back over our communities, man. Let's start with the youth, the school systems, and what we exposing our kids to, and the list goes on. But until we really put our hand on our own communities, it's pretty much going to get worse. So I really want people to take that serious and understand that now is the time to do that. Now is the time to do that. And if it's just one kid a day, you're doing something. So that's pretty much all I got to say. I'm looking forward to the next time. I appreciate everybody sharing their knowledge. It seems like some dope individuals on the phone, and I salute to all y'all. So, y'all got
Thank you so much.
Yeah, y'all hit me up whenever. Y'all want to just build and chop it up, hit me up.
I absolutely will. Thank you guys so much for your closing remarks. And again, as I said earlier, I really am grateful for this. I'm humbled to have people like you to call my friends, my associates, whatever you guys want to call me. I'm just appreciative. So thank you guys so much. Enjoy the rest of your day. And I will be in touch with you guys about part 2. And like I said, I want this to be about all of us. If you guys have any topics, please let me know. What you want the next topic to be about. But enjoy the rest of your Saturday, guys. Thank you so much. It's a lot of love from me.
Thank you. Have a good one.
You too.